Okay, home stretch, the last page. So hyperventilation can cause alkalosis, which is a problem. So we have this overbreathing. So what happens is we get an increase of CO2 building up in the body. Typically they complain about having a panic attack or their anxiety. They might be dizziness or feeling numbness or tingling in their extremities or spasms in the hands and feet because they're not getting enough oxygen. We do not have them breathe into a paper bag like they do in the movies. What we do is coached breathing. So we have them breathe with us. We get them on O2, and if we can't get this to resolve, they get a transport. So they're more of a stay and play, and then they go if we can't, because our concern is alkalosis. And if you turn to the next page in this, it'll explain the difference between alkalosis and acidosis. Environmental controls. Big thing here, scene safety. Can't stress it enough. Get the patient out of the environment. Pesticides, cleaning solution, carbon monoxide are our biggies for this. We'll talk about more later on when we talk about poisons. But O2, airway adjuncts, and suction, that's what we need to do for them. But getting them out of the environment is key. The last one is cystic fibrosis. It's a genetic condition. I don't know why this is part of them. Because there's some other conditions. Constant airway problems. These guys are in and out of the hospital a lot. They will have a stack of medical history. They generate lots of mucus, so you need to suction in as needed. Make sure you bring all of your meds with you. And let the hospital know they have cystic fibrosis because they're very careful about who they mix these people with because they don't want them getting other infections. One way to remember all of this with respiratory is by doing a PACE assessment. Progression. Has it gotten better or worse since they called you? Is it associated with chest pain? Yes or no? Is there sputum? What are they coughing up? Is it green, cloudy, clear, bloody? So pneumonia, some other type of infection, not good. Do they have talking tiredness? So they can't get full sentences out. They talk in little chunks or one-word things. And do they have exercise tolerance? So when they move or walk, does it make their breathing better or worse? So those are all the respiratory emergencies.